Hello! Today we're discussing a critical topic, how cannabis can be used to support glioblastoma treatment and enhance the quality of life for patients. This video is dedicated to Miriam Pina, whose passing inspired the creation of the cannabis brand Miriam's Hemp. Before we get started, please note that Miriam's Hemp does not give or substitute for medical advice. Miriam's Hemp specifically invokes the First Amendment rights of freedom of speech and of the press without prejudice. Any statements made in the video have not been evaluated by the Food and Drug Administration. Any products discussed are not intended to diagnose, cure, prevent, or treat any disease. Miriam's Hemp always recommends, when and wherever possible, that licensed local healthcare professionals be consulted. Understanding glioblastoma. Glioblastoma multiforme, also known as GBM, is an aggressive form of cancer that occurs in the brain or spinal cord. It originates in the brain's glial cells, which are vital to nerve cell function. Depending on which type of glial cell the tumor originates from, gliomas are classified into different types, including astrocytes, oligodendrocytes, and epidermal cells. Glioblastomas specifically form from star-shaped cells called astrocytes that support nerve cells. GBM accounts for almost half of all cancerous brain tumors and is known for its aggressive nature and resistance to traditional treatments. Glioblastoma presents a significant challenge for patients and medical professionals alike. Facing prognosis with hope. One of the biggest challenges in treating glioblastoma is its heterogeneity. This means that tumors can differ widely between adult and pediatric patients, complicating the search for a universal treatment. Furthermore, while the blood-brain barrier safeguards the brain from toxins, it also hinders many potentially effective drugs from reaching the tumor. Embracing each day with courage and hope is essential. Each patient's journey is unique, shaped by factors like age, overall health, and the specific characteristics of the cancer. Glioblastoma symptoms often manifest as persistent headaches, seizures, cognitive changes, motor and speech difficulties, and vision problems. Most adults typically live about 12 to 18 months after diagnosis. Standard treatments for glioblastoma include surgery, radiation therapy, and chemotherapy. Researchers have begun to explore alternative treatments, including the potential of cannabis. Cannabis and glioblastoma research. Cannabis contains over 100 cannabinoids, the most well-known being THC and CBD. These compounds interact with the body's endocannabinoid system, which plays a crucial role in regulating various physiological processes. Emerging research suggests that cannabinoids, the compounds found in cannabis, may have a potential as a complementary treatment by inhibiting tumor growth, inducing cancer cell death, and alleviating symptoms. A pilot clinical study was conducted and published in the British Journal of Cancer to investigate the effects of THC on patients with recurrent glioblastoma multiforme. Patients who were enrolled in the study were diagnosed with recurrent GBM and had previously undergone standard treatments such as surgery, radiation, and/or chemotherapy. Researchers administered THC directly into the tumor site via intracranial infusion. In this study, patients received THC treatment over a 6-week period with regular monitoring throughout the duration. THC was found to be generally well tolerated by the majority of patients with manageable side effects. Some patients showed signs of tumor reduction or stabilization, suggesting potential anti-tumor activity of THC. Improvements in quality of life were noted, particularly in areas such as pain relief and reduction of chemotherapy-induced nausea and vomiting. Additionally, a study published by the International Journal of Molecular Sciences found that cannabinoids could enhance the effectiveness of traditional chemotherapy, potentially leading to better outcomes for patients. Cannabinoids like THC and CBD have demonstrated anti-tumor effects in various cancer types, including inducing cancer cell death and preventing metastasis. Metastasis is the spread of cancer cells from one part of the body to another. Cannabinoids have been effective in managing cancer-related symptoms such as pain, nausea, vomiting, and loss of appetite, improving the overall quality of life for patients. A key study published in Frontiers in Molecular Neuroscience highlighted the potential of CBD to inhibit glioblastoma cell migration and invasion, suggesting that it may serve as a valuable adjunct therapy. The best studied effects of cannabinoids on GBM is the inhibition of tumor growth. Cannabinoids were found to interact with CB1 and CB2 receptors, affecting signaling pathways that control cell survival in apoptosis. They also inhibited angiogenesis, reducing the blood supply to tumors and limited tumor cell migration and invasion. This outcome seems to be a recurring theme among numerous research investigations. Another study discovered that THC can slow down and stop the growth of glioblastoma cells by lowering the levels of E2F1, a key protein needed for cell growth. This makes THC a potential treatment for GBM by preventing cancer cells from growing and promoting their death. More research is needed to confirm these findings and to explore how THC can be used in patients with GBM. Research indicates that CBD can make glioblastoma cells more sensitive to chemotherapy by activating the TRPV2 channel. This combination enhances the uptake and effectiveness of chemotherapeutic agents, leading to increased cancer cell death and slower tumor growth. These findings suggest that CBD could be used to improve the effectiveness of existing chemotherapy treatments for GBM. However, further research is necessary to confirm these results and determine the best ways to use CBD in cancer therapy. A study investigated the metabolism of endocannabinoids in human glioblastomas and meningiomas, comparing these cancerous tissues to non-tumor brain tissue. Researchers found that glioblastomas exhibited significantly altered levels of endocannabinoids, which increased concentrations of anandamide and 2-AG, indicating a disruption in normal metabolic pathways. In contrast, meningiomas showed different metabolic profiles, suggesting distinct regulatory mechanisms at play. The findings highlight the potential for targeting endocannabinoid metabolism as a therapeutic strategy in brain tumors, emphasizing the need for further exploration of the endocannabinoid's role in tumor biology and treatment response. The potential of CBG in treating glioblastoma. Cannabigerol, also known as CBG, offers promising potential in the treatment of glioblastoma. Unlike THC, which can impair cognitive function, CBG is an alternative that has demonstrated anti-tumoral properties. It effectively targets and destroys glioblastoma stem cells, which are often resistant to conventional treatments. While research is still in its early stages, the advancements suggest a hopeful future for incorporating CBG into glioblastoma treatment protocols. It's important for patients to consult with their healthcare providers before starting any new treatments, including cannabis. Each case is unique, and professional guidance ensures that treatments are safe and appropriate. Thank you for joining us today. If you found this video informative, please like, share, and subscribe to our channel for more updates on cannabis research and its potential applications. If you have any questions or topics you'd like us to cover, leave a comment below. Together we can stay informed and support advancements in medical science. Until next time, stay curious and take care.